My name is Hain. I'm a student operating department practitioner, and previously I was an officer in the Royal Engineers. I have a defined role, but I'm part of a team and then part of a wider organisation as well, which is very similar to when I was in the army. It also, that wider organisation means there's a huge scope for things that I can go and do once I've done this for a few years. It's also the sense of humour. I'm sure everyone says that, but it's absolutely the same sense of humour, and it's an enjoyable team working environment. I was really lucky. I already had a degree, so that meant that I could go straight to university and I didn't need to gain any other educational qualifications. But I needed to make sure that being an ODP was the role that I definitely wanted to do. So I got in touch with the hospital and they were happy to have me for a day's visiting where I shadowed an ODP in the various roles that they did, which helped me really understand what the role was and made sure that it's what I wanted to do. I think allied health professions are 50% non-technical skills and 50% the technical skill that you need to do your specific role. The non-technical skills, people in the army don't even realise they already have them. And they're your teamwork, your leadership, your decision-making ability, your situational awareness, that understanding of what's going on and the role that you need to play in assisting with that wider organisation. And that's something that naturally people in the military just have. When I left the military, I knew I wanted to get into healthcare. I'd looked at physiotherapy, I'd looked at becoming a paramedic because we know about those. And it wasn't until I had to have an operation on my hand and I was allowed to be awake for that procedure, and I got chatting to the ODP in theatres, and I left theatres with my hand in a cast and the email address for the local university. Found out a bit more about the role, decided that's what I wanted to do, and was in university by the time I had the cast off. When someone comes down for a procedure, they're in a very vulnerable state. They come to theatre, they don't really know what's happening, they're in a hospital gown. We go and collect them and then we take them around to the anaesthetic room. We'll help calm them down and be able to answer their questions. From that point on, our job becomes quite technical and we're assisting the anaesthetist or we're assisting the surgeon. When the patient's procedure has finished, they go to the recovery room. ODPs look after patients in recovery and we look after their needs during that time when they're very disorientated, they don't know what's going on, and we look after them until they're awake enough to go back up to the ward.